So I currently work for the West Midlands Academic Health Science Network. I work within the digital team. I've worked in the NHS for about 10 years. I've been leading on transformation programs and service improvement programs across acute, community, mental health and the third sector. The majority of these have been large-scale transformation programs that seek to improve how we deliver health and social care services. In my role more recently as a digital health innovation manager, our primary focus is around the adoption and implementation of digital innovation that helps to deliver better services for citizens across the West Midlands. At this present point in time, I'm currently the lead for the HSN around 5G and connectivity, remote monitoring, and growing our social enterprises through our SME incubator. Over the last 5 years, and I'd say probably more recently over the last year in response to the COVID-19 pandemic, the two areas that really have excelled is digital transformation and system collaboration. On digital transformation, we've seen this accelerated growth of virtual consultations, of remote monitoring, remote diagnostics, which then lead to the emerging application of artificial intelligence. COVID-19 has spurred a lot of this activity on with the requirement to have less face-to-face interactions with healthcare, and that's really driven the digital agenda. The other thing that the pandemic has created is greater system collaboration. There's more of this opportunity to share what is working well in the field of innovation. And a lot of the big system-wide transformation projects are actually facilitated by the ability to operate through virtual consultations, whereas previously it would have been a meeting once every 3 months to get all the right individuals into the same room. Now that can happen weekly, so we're really starting to see some accelerated growth. So introducing innovation into health and social care is fraught with many challenges, which isn't to say that it is impossible, but it just means there are a lot more requirements and considerations that you need to put within your innovation or within your plan in order for it to be adopted and scaled at pace. So the first one is around patient safety, and any innovation must have a true understanding of the potential unintended consequences that innovation can have, whether that's directly to the patient or whether it's to another service or another department. Another key aspect that the NHS really holds dear is around having evidence of impact and having that full understanding of the impact that your innovation will have in terms of time, cost and quality, and then being able to evidence this, because this then further supports the spread and scale of any innovation. Quite often we see innovations that are trying to address a very local problem, which is not very good for an innovator in that it provides such a small marketplace. In our work within the Academic Health Science Network is identifying those innovations that not just solve a problem for one area, but solve it for a number. Third one, integration. As we become more of a data-driven society, there's more of a requirement these days for innovations to integrate with other systems. And that's going to be central, and the importance of data and transferring between systems and being aggregated to drive further intelligence is going to be a must. Final one, working within the law. Might sound strange because we're all lawful, but one of the challenges in healthcare is around information governance and the protection of patients' data, and developing innovations that are safe and secure and manage data appropriately all needs to be put in the planning process as part of any innovation. So growth areas in health and social care at the moment, there's a direct ones which are as a result of the pandemic, and a lot of these have started as initial pilots, even though they've been spoken about for quite some time, but these will certainly grow. The first one is around remote monitoring, which I've mentioned before, which is the ability to understand a patient's health condition without the need for them to go into hospital. And that's important because it allows services to be able to manage their capacity and their demand, but it also allows them to be responsive to patients that are becoming unwell and treat them sooner. The other one is around integration and population health management. So systems, health and social care, using the power of their collected data in order to make better and more informed decisions about how they treat patients, but also at a larger scale in terms of population health management and what new services or what new interventions can be put in place in order to improve whole population health and well-being. The other growth area that almost sits alongside the digital is care pathway redesign. We need to think of digital as an enabler, not the solution. And what these digital solutions offer is an opportunity to completely rethink how we deliver services. Another growth area is artificial intelligence, which does actually link to remote monitoring and integration and also pathway redesign. And it is the appropriate use of artificial intelligence to make better and informed decisions over the data that we collect from, system level, at patient level. That's certainly going to be a growth area, but it's not without its challenges around ethics and efficacy. And finally, the other growth areas around collaboration and co-design. I think there's more of a willingness across the system and also between industry and healthcare to collaborate and co-design on innovations that are truly transformational.